Hi, welcome back to Richo. Tonight I thought we might just have a look at this whole question of drugs in Australia. Now, like you pick up the papers, you watch the television, you listen to the radio, and you hear about these massive drug seizures all the time. Literally a tonne here, 100 kilos there, massive seizures of all kinds of drugs. Heroin, there was a very big seizure 2 weeks ago, very big. I don't know, it must be hard to get heroin on the streets of Sydney at the moment, or Melbourne. Personally, I don't use the stuff, so I wouldn't know, but I'm assuming. There's cocaine seizures all the time. Ice, which is the sort of coming drug, the drug of the masses, if you like. There's always been a lot of marijuana. We find the odd forest full of it every now and again, or the odd greenhouse full of it. These drugs are everywhere and they're constant, and it's all the time. That means that, in my view, there must be millions of Australians who are using them, because the reality is, if you're reading about those seizures, I keep hearing that there's something like 5 to 10%, that is, of what gets into Australia. That means there's an awful lot of drugs out there and an awful lot of people using them. Firstly, I want to speak to Professor Alison Ritter from the National Drug and Alcohol Research Centre. We've also got Jioji Ravulo from Youth Services Manager at Mission Australia. We've got, in Brisbane, Dr Wendyl Rose, who's a GP, has worked in the prison system for more than 30 years. So I think he's worked with enough drug addicts to know something. Reverend Capsis, a former chaplain for the Cronulla Sharks, which I will hold against him.
I'll talk to you about that later, Richo.
I will hold against him, but he's a local Shire councillor, but importantly, he's Director of Community Outreach Ministries Incorporated. So let's just have a first, can I ask Professor Ritter, Alison, if you look at those figures of the seizures, they are massive. Is it true to say that 5 to 10% is all that we're seeing, that the rest get through?
Well, it's really hard to estimate what proportion actually get through compared to what we're seeing, but we think it might be anywhere between 5% and 30%. We don't know. No one's done the research to show how much is actually getting into the country that goes undetected. But clearly it's a profitable industry, and there are people making money out of bringing drugs into Australia.
Well, obviously, and we're catching a lot of people, and yet there's going to be any number of people willing to take their place.
Well, because it's such a highly profitable industry, in fact, if you compare it to human trafficking and illegal guns, it's actually a bigger industry internationally than those other illegal industries. So there's a lot of money to be made.
So is it the biggest single international industry?
The figures are a bit dated, but a few years ago it was the biggest single illicit market, yes.
And I mean, you hear lots of things about it, but one of the things that's always got my interest in this is about 4 years ago, a very senior New South Wales policeman, and I won't name him to save embarrassment, wanted me to go and talk to the then Premier Morris Yemba to tell him that an awful lot of resources, police resources, went into chasing cocaine and ecstasy, and he said to me, cocaine kills no one, 3 people a year die from ecstasy, and yet ice is out there, and if we could just forget about the others and go after ice, it's what makes people psychotic, it's cheap, so that you don't have to be rich to buy it. Like, obviously with cocaine you got to have money, but with ice you don't. And he said that it has a terrible effect. At St Vincent's Hospital, the emergency section at the Cross here, they've got 2 padded rooms built to put ice addicts because they go so crazy. Is ice the big deal that they think it is, or not?
Unfortunately, it probably isn't. Well, it depends on how you want to measure harmfulness. So the most harmful drug is heroin, because it kills people. And at the height of the heroin epidemic in 1998, 1999, we had more than 1,000 people who died, young people, every year died from heroin.
Those numbers have dropped substantially,
They have. We're up to around 370 deaths per annum.
Still a lot.
So, well, a death every day from an illegal substance is a significant problem. Crystal methamphetamine, or ice, doesn't have the mortality associated with it, but it has the mental health problems. So you get the aggression, the antisocial behaviour, the psychosis. But the question is, which one's more important or more harmful to the community? Is it lives lost, or is it mental health? And this is where you start to get into tricky debates about which drug should we focus on. The other issue is what proportion of people are using the drug. So the most commonly used drug is cannabis.
Obviously. I mean,
less than 1% of the population use heroin and methamphetamine.
Way back when I was Health Minister, I had a lot of people telling me that I should be working towards legalising cannabis.
Indeed.
But the more I read about it, the less keen that I got about legalising it, because it seems that if you're given to depression, it makes it a lot worse.
Sure. And psychosis in young people as well.
Yeah, it can be a huge problem.
Yeah.
So it's hard to know where to start, is it not? Can I ask Jioji Ravulo from Mission Australia? Now, you've been working with people with drug problems for quite some time. Is it getting worse? Are there millions using it?
We see it consistently with a lot of the young people that we work with, and many of the different services that we run under Mission Australia. A lot of people that we come into contact with may have a rate or use of substances. So, for example, young offenders that I'm involved with working with in southwest Sydney, a high proportion of them generally will have some form of significant history with alcohol and other drugs, and that's a problem in itself. So it seems to be a bit of a trend when it comes to having contact with certain young people. And our role as an organisation is to provide the support needed for them to move beyond the issues associated with alcohol and other drugs. Of course, as we all know, there are many problems that may occur as a result of being on some form of alcohol or other drug substances.
What substances are you finding that they're on most?
A mix. So it ranges from anywhere between using alcohol extensively to using pot, to also they mix that with alcohol.
In your view, for young people, pot's still the drug of choice?
Very much so. That is generally a lot more accessible at times, we find, in regards to young people and their usage. And they generally, in our experience also, we've found that young people go to using speed. Ice has been an issue over the last couple of years, and I've worked with a variety of different young people that have been on that substance. But most of the time it's alcohol and marijuana.
All right, the Reverend George Capsis, I noticed that Jioji mentioned continually alcohol. Is that a bigger problem than these others?
Oh, I guess community-wise it would be a bigger problem. More people affected by alcohol than a lot of the other ones. Then I guess.
And it's legal.
It's legal. I mean, you're not going to unlegalise it now, but
you wouldn't have thought.
Can you imagine standing around the barbie and all having a drink and a joint, a bit of heroin or a bit of something else? If you legalise it, that might be what you're going to do with these other drugs, these illegal drugs.
Yeah, so as far as you're concerned then, the other drugs, which is the worst one? Which is the one you come across the most?
Well, marijuana and ice. I run homes for homeless people who usually got one or other addiction. And the ice people, they're really going crazy, break things, break walls.
Yeah.
Marijuana people end up in the psych ward. The psych ward's full of people. Remember, it was called a soft drug once upon a time. Nothing soft about it. And I reckon we're going to see big problems as that generation matures, gets older. Bigger problems are going to come out health-wise with them.
Yeah, well, it's smoking anyway. I mean, one thing about marijuana that I couldn't stand if I wanted to is the smoking part of it.
It stinks, doesn't it?
Oh, it's horrible. I just can't imagine how people can do it. Can I get to Dr. Rose here, Dr. Wendyl Rose up there in Brisbane? Now, you work with people in prisons.